Hi there, Dr. Sadaf Qureshi here, and today we are going to talk about anatomical planes. We will start our topic with introduction. Anatomical planes are imaginary flat surfaces used to divide the human body into sections for better understanding of its structure and function. They are essential in anatomy, medical imaging, and surgical procedures. Now let's talk about what are the types of anatomical planes that are available or that are there. Then we have sagittal plane, then we have coronal plane, transverse plane, and oblique plane. The first three planes are the main anatomical plane, and the fourth one is accessory anatomical plane. So overall we have four anatomical planes: sagittal plane, coronal plane, transverse plane, and oblique plane. Now we will talk about them one by one in detail. First we will talk about sagittal plane. Sagittal plane is, as you can see in the picture, it is one of the primary anatomical plane that is used to describe the orientation and movements of body. The sagittal plane is a vertical plane. It divides the body into left and right section, as you can see in the picture. It runs parallel to the midline of body and is perpendicular to the coronal and transverse plane. Now let's talk about what are the further types of sagittal plane. Its sagittal plane is mid-sagittal plane, that is also called as median plane. This plane runs directly along the midline of the body, dividing into equal left and right halves. It passes through the structure like navel and spine. Then we have other type of sagittal plane that is called as parasagittal plane. It is any sagittal plane that is parallel to the mid-sagittal plane but does not run along the midline. It divides the body into unequal left and right sections. Then let's talk about what are the movements that are possible in sagittal planes. Movement within this plane occurs forward and backward direction. Examples include flexion, that is decreasing the angle between two body parts. Then we have extension, that is increasing the angle between two body parts. And then we have hyperextension, that is extending a joint beyond its normal range of motion. And dorsiflexion and plantar flexion, that are movements of foot at the ankle joint. Now let's talk about the coronal plane. Coronal plane, as you can see in the picture, it is also known as frontal plane, is one of the primary anatomical planes used to describe the orientation and division of human body. It is vertical plane that divides the body into anterior and posterior section. As you can see the picture, the portion of the body anterior to the plane is called as anterior section, and portion of body posterior to the plane is called as posterior section. It runs perpendicular to the sagittal plane and is parallel to the transverse plane. The coronal plane is vertically oriented, running from side to side. It separates the body into front and back half, making it useful for studying the spatial relationship of the structures. Now let's talk about what are the movements that happens in coronal plane. Movement within this plane occurs side to side. Examples include abduction. Movement away from the midline is called as abduction. And then we have adduction, that is movement towards the midline. Then we will talk about the next plane, that is transverse plane. So in transverse plane, that you can see in the picture, this plane is transverse plane. This is also known as horizontal plane or axial plane. It is one of the primary anatomical plane used to describe the orientation and division of human body. The transverse plane is horizontal plane that divides the body into superior part and inferior part, or superior section and inferior section. It runs perpendicular to both sagittal and coronal plane. As you can see, the body part above the that transverse plane is superior part, and below the transverse plane is inferior part. The transverse plane is parallel to the ground when the body is in the standard anatomical position. It can intersect the body at any level from the head to feet. Now let's talk about what are the movements that are possible in transverse plane. These are the movements that involve rotation. Examples include internal rotation or medial rotation, that is rotating a limb towards the midline. Then we have external rotation or lateral rotation, that is rotating the limb away from the midline. Then we have its axial rotation, that is twisting movement of spine or head. Now let's talk about the oblique plane. Oblique plane is unique anatomical plane that cuts through the body at an angle, rather than being strictly horizontal or vertical like transverse sagittal or coronal plane. This oblique plane is any plane that is not parallel to the standard anatomical planes that are sagittal, coronal, or transverse plane. It intersects the body at any angle, providing a diagonal view of anatomical structures. The oblique plane can pass through the body at various angles, offering a unique perspective on anatomical relationship. It is particularly useful for visualizing complex structures that cannot be fully appreciated in standard planes. Now let's talk about the significance of anatomical planes. We talked about all the anatomical planes types and their movements possible in these planes. Now we will talk about the significance of anatomical planes. The first significance is medical imaging. Anatomical planes are used to interpret X-rays, CT scans, and MRIs and other medical imaging techniques that are available now. Then the other significance of anatomical plane is surgical procedures. Surgeons use these planes to plan and execute operation. Another significance of it is anatomical study. They help in understanding the spatial relationship between organs and structure. And the last significance of it is exercise and rehabilitation. As many exercises such as squats, lunges, and running involve movements in the sagittal plane. So this was all about the types of sagittal plane, importance of sagittal planes, sorry, anatomical planes, and the significance of anatomical planes. If you liked our video, don't forget to like, share, subscribe, and comment. Thank you for watching.